Surviving Veterinary Medicine. Be smart, be bold, be creative, and be your own boss. At the very least, find a practice where you can do what you do in the most positive way that gives you the space to practice medicine as you see fit. Because at SVM, we set a higher standard for medicine than what you learned in school. I'm your host, Dr. Narda Robinson, veterinarian, osteopathic physician, and leader of the Vet Med Revolution, calling for safer, gentler, and more effective medicine for animals and their people. In this month's podcast, I'm interviewing Dr. Alan Landis, who's a local equine practitioner in LaPorte, Colorado. Alan has also been a long-standing instructor with our Medical Acupuncture for Veterinarians program. He's kind, patient, and does everything that a general practitioner would do, including acupuncture and some rehabilitation exercises for his patients as well.
The only reason I was drawn to our program here with acupuncture is because it was evidence-based.
Yeah.
That was the whole reason I even came over to this area to look, was because evidence-based.
Right.
And there was just no way for me to go otherwise. Because, when I got out of school in 96, it was like we learned to cut, we learned to do medicine, we learned to vaccinate and, do dentals. And that's what we did in the equine business.
Right.
So it was one of those things where, that's what we did. And then when we looked at alternative things, it was like woo-woo.
Yeah. Yeah. And then, like Gail Trotter and Gary Baxter, they had, they both took my course and they were both interested. So, and then I remember doing a couple cases over in the large, of course, that was just me at the time. With Dr. Stashak. So, and then Dr. McElraith was really supportive. And that's when we outgrew CSU back in 2001 and went to the Equine Center because they had more room and capacity. So yeah, that was a really pivotal sort of number of years around that time after we both had gotten out of school. And
yeah, it was one of those times where I had talked to Gail Trotter about it, and he's like, there are times when these just come in and all I can do is cut them, and there's got to be something I can do before that.
Right.
Agreed. So it was eye-opening to see that kind of transformation in a surgeon.
Yeah.
For him to go, well, there's got to be more than just cutting him.
Right. Yeah, those were the days. That was, I look back, after everything, and it's just like that was a special period of time where, Dr. Nelson was the director of the hospital, and and it I don't know if in your year, if it was first in my year where they started to have the business classes. It was in third year.
Yeah. Yep. They were doing business classes. Yeah. Absolutely.
Yeah. And it was premature, I thought, because we were, third years, not fourth years, but also I was very bored. So, aside from treating my fellow students at the back of the room with acupuncture, I don't know. Anyways, that was when I proposed starting the acupuncture course or the acupuncture service at CSU. Thanks to that course, even though I skipped a lot of them, but because you submit your resume and it says what do you want to do? And I said, I think we should start a course. And then Dr. Ogilvy helped, and he was a real champion, to do this and everything. So that, it was those two people that were pivotal for me to even start there. So I just look back because just over the ensuing years, it was not the same kind of just environment. And yeah.
There was a lot of people that kind of looked ahead and kind of saw what needs to be done as far as the future of veterinary medicine goes.
Yeah.
And I think with your insight to look at that too, is to can we integrate all this? Because you knew at the time what it would do, but you had to convince everybody else.
Well, and at that time that was sort of my full scientific conversion because I had come out of the UCLA for for physician's course and everything, and there was still some of that chi. And then I just remember being up at the front of the room one time and describing we don't even teach it anymore, the piloerector response along the bladder meridian.
Oh, really?
It was called PRABM because this is what Ivis would teach. And it's when you would, here's puppet, this would be a horse, but you'd put a needle in the back and somehow, you would sometimes get these tufts of hair, these piloerector responses. Yeah. Do you get that sometimes?
I've seen some fasciculations further up towards the cranium,
Yeah.
So you would see that kind of thing where you needle them and you go, whoa. And even with laser, you can see that occur where you see the fasciculations occur up above. Yeah.
Yeah. Well, and that makes sense because it's this whole longitudinal muscle. And I think that there were just, sometimes just episodes of probably the fascia releasing when you get to certain intercostal spaces. Anyways, I just remembered one time at the front of the room, I was at the front board and I was like, well, there's no way that there's one nerve that connects all this. So it has to be energy. And then just when just like one of the three people that started Ivis that had broken away was a good friend of mine. And he is just pummeling me with scientific information and neurophysiology. And I just had to give. And so that was around 2001, 2002. And there was a big rebellion among the teachers of the course because they were like, oh, I don't know. If we go all scientific, what's going to happen? We're not sure. It was just those early revolution repercussion things. But anyway, so I think we've all kind of had our journeys. But so today, I mean, we're kind of talking about it already, but the podcast is, as you know, Surviving Veterinary Medicine.
Yeah.
Yeah. And so, like, especially in the last few years where people there's more recognition of just burnout and depression and suicide and everything. Yeah. So that's why we tend to talk about, in addition to professional stuff, because I think that the people that come to our courses, are ready for a change.
Right.
And so we see that. And then also, like, even beginning in vet school, and we have all these vet students, but they start to, I think, lose a lot of their enthusiasm sometimes in school, especially you had mentioned, in school we were taught drugs and surgery and not much else, vaccinations, whatever.
Right.
And so if they're not exposed to this, and especially when they go into corporate, I don't know. So those are kind of the two things is like.
Yeah, I look at, to me, when I took the course in 2012, I'd already been out since 96, so several years. Mm-hmm. Almost, over 10. And, it's going to get in that middle time between your 10 and 20 years of being out of vet school. Mm-hmm. And you're reflecting on where you've been and what you've done and the cases that you've seen. And like, there was still something that I felt like there was more I could do. And I had met Tim Holt and I had met Pam Mahonen, and it was one of those things where, wow, you stick a needle in here and you get this effect. Right. And I go, well, there's got to be something more to that. And I knew, because I knew you from school, but I had followed your progression and how, well, you've got scientific data that backs this up. This isn't just that Chinese medicine that I've heard about when I was in all this time, and how that would be set aside and like, well, that's just woo-woo kind of stuff. So, when I went to look at it more, when I started doing the classes, I was at first very overwhelmed with the neuroanatomy and trying to remember back those 15 years plus of, even before that, my anatomy course was like, wow, that was just a phase of like, all of a sudden we're into the leg again,
Right.
and to try to learn all the different things of the different species, the cat and the dog and the horse and the cow, whatever. But then trying to remember back to that neuroanatomy. And for me, still, I have to look up lower motor neuron size and upper motor neuron size to get them right. But to to go back and be that. But then it sunk into me at that time that this is something fresh. This is something that, how can I integrate this into my practice? And so I kept looking around and I'm like, well, of course, all these horses have back pain, but why? And is it saddle fit? Is it poor posture? I remember one of my mentors that was an employer of mine. He would always say, well, you palpate across the lumbar area to see if they've got hock pain. Well, and I was like, okay, that sounds good, but why is that? Why is that? Well, maybe they have hock arthritis, some sort of osteoarthritis, but then they refer it back up to the lumbar area because they're carrying themselves differently. So how can we fix that? Well, you inject the hocks. Well, that's not just the only thing we can do now. Right. Now I see that. I can see that with my acupuncture, my laser therapy, my massage that I can do on these guys. There is so much more. Yes, I can treat the initial problem of the hocks being sore, but then I can help relieve the pain and get them back into it even further. So to me, it added a different thing to me, and it made me go from surviving veterinary medicine to thriving. Right. And I really believe that my practice has thrived. I can't tell you when I purchased my practice in 2008, and it was that kind of in-between period where I needed to keep it going because it was already an established practice, right? Mm-hmm. And keep it going versus getting it to really proliferate and really build and grow. Yeah. And so, that time frame where I took the course, and it helped me to realize that not only can I add more to my repertoire of things I can do and increase my bottom line, but it also increased my feeling of I did something good for this horse. Besides, I did all I could do for this horse to help it better itself and make it feel better. Right. It was just one of those things where I feel like it's still a struggle to be a veterinarian and to be a business owner and to take all these on. I mean, the last 5 days I've interviewed 4 different technicians to come on board with me, because I just need it. I need my technician. I need a technician. I had lost one in August, so I needed to take one on. And so it's just, and then try to practice. And, right. Thank goodness it's a slow time of period for me, but, still it was that kind of thing. But, when I go to show them the different things that I do as an interview, I'm always happy to get to the acupuncture part because right. Then I ask them, what do you know of acupuncture? Well, and some of these most of them have been in small animal. And one of them said, we do have Dr. Dixon come in and do the acupuncture for us at our clinic. I'm like, oh, well, that's good because I know Sean. And, mm-hmm. That's a good thing because then she's been introduced to me in the right way. Right. In the correct way. So right. Anyway, it's really built the practice around, not so much around the acupuncture, but it has lent itself to everything that I do. From pre-purchase exams, when I'm laying my hands on the horse, I'm more cognizant of areas of pain and when I'm palpating them and looking at them. And same way with lameness exams, because that's part of it. And even more neuro exams into these kind of things. I've got a client that really wants to that really is good at looking at neural horses just because she gets to see them sent to her as a trainer. Oh, wow. And she's also worked as she's a certified vet tech, and she's worked as a vet tech for an equine guy back in Washington State and for years. And so she would see these neuro cases, but it's mind-boggling how they come up to her and say, well, the horse was kind of leaning when I go to get on it. Well, why is it leaning? Mm-hmm. And then she does a basic little neuro exam and then goes, Doc, you need to come look at this horse. Yeah. So it's one of those things where it's broadened so much my scope of practice in that I use everything that I learned in the acupuncture course and continue to learn and relearn and put that into practice on these horses and to look at them.
Right. So, I mean, so I think what happens too is that you get a better bond with the horse and the client. And that just seems like a better way to live and do medicine,
Oh,
whatever.
absolutely.
Yeah.
Absolutely. Yeah. I mean, there was a case just recently where I had the client asked me to come out and do some acupuncture on a horse. She says she's not really lame, but she just is puts her head up high and hollows out her back. I'm like, okay, well, so as I go through my acupuncture exam, I find that she is sore backed, and I ask her about saddle fit, and she says, "Yeah, we just changed that recently in the last couple months. So good, that's good. We're getting it better." But then I also come around the stomach 6 point TMJ, and she's very sore there.
Oh,
She needed her teeth done,
yeah.
and if I wouldn't have seen that, if I wouldn't have gone that way um, with the acupuncture exam, I might not have noticed the TMJ being sore and her teeth needing me done.
Right, right. And that's kind of the animal part of the surviving veterinary medicine whereas the animal should survive, hopefully, and the client, not be, all their resources drained and everything, and to have a good rapport with the veterinarian and then us, and then, vet techs. And I think I mean, they have their own sort of parallel angst and,
Yes.
loss of, why am I here ideas. So,
And that's what I kind of got with these four people that I interviewed is that, why is it that you're wanting to leave where you're at,
mm,
small animal wise? And one of them said, I'm bored doing the routine.
mhm.
Okay. And another one said, well, it's just, I don't really like doing fecals all day.
Oh, yeah.
I- you know, and it's, they get a burnout in that kind of thing where it's the same thing most every day and all in and out and in and out like that. Your general wellness exams, your vaccinations, your spay and neuter kind of thing like that. And so, one of those interviewees I took out yesterday, we were doing a bunch of rescue horses that were kind of like wild Mustangs,
Oh, wow.
and they were very difficult to get done. And she saw a whole different view of veterinary medicine compared to what she's used to in small animal stuff. So,
Yeah.
and I can see where those even technicians will get burnout, and you
Yeah.
got to get them a fresh start. And so incorporating acupuncture makes them realize that there's something different. There's something extra in there that they can help with,
Right.
and I think the next tech that I bring on is going to go through your tech course
Yeah.
so that she realizes, and all of these have been she's that I've interviewed, but
Yeah.
but they'll realize the significance of what I'm doing. The
Mhm.
last technician I had, she came on right in 2019, where we still had the in-person in October session,
Oh, yeah.
and she was there holding horses.
Yeah.
But she got to see a little bit of what we did, but she didn't get to learn the ins and outs. I tried to teach her a little bit, so that she would be excited about it when she could go, because sometimes she'll be maybe standing next to the client as I go back to the truck or vice versa, whatever, and she'll talk. And that's a good thing.
Yeah.
Good thing to talk to the client about these things.
Right. Right. And that's kind of the purpose of the tech course is to teach them the scientific basis, but also give them enough understanding that they can be your interface with clients. I mean,
Right.
you have maybe more of a one-on-one with your type of work, but yeah, educating them. And I think that's a role that vet techs could really move into is sort sort of the full case uh, coordination and management and coming up with ideas that the client can consider, and just being an advocate, but also it being a scientific approach, and sometimes maybe spending more time with the client and the animal if you had to do something else. And now that
Exactly.
and so but they in the vet tech or nurse journals and things, I mean they wrestle with the same things, and then maybe at shelters they're putting down animals. I mean, I think it's hard, and they're not that well compensated, and just the boredom. Like Steve always says, he was board certified and being bored
Yeah.
previous to acupuncture.
Yeah, exactly. Right. Yeah. And I think that getting them out, and of course, my practice is one of those that I drive around a lot and I see a lot of different cases, different things, but then there is that seasonal thing where we are just doing vaccinations and dentistries, and that's about all we're doing, and that can be a little bit boredom and tedious, but again, it's a different environment and we're out in the open, so it's nice that
Oh yeah.
way.
No, it sounds great. I mean, and I mean, it makes me feel like, well, maybe I could do it. Are you taking people like vets techs that were all small animal? I mean, how much do they know about horses before?
Here's the thing: is when they go through a vet tech school. So I've got two people that went through tech school. They focus mainly on the small animal side because that's where their employment opportunities are most likely. It's rare to have, really, it's rare for an equine practitioner, unless it's a multi-doctor practice, to have technicians.
Oh.
So as a solo practitioner, I finally saw the need of needing somebody to go with me and assist me. And I would say that's probably helped my bottom line to begin with, as far as they pay for themselves.
Yeah.
They actually pay for themselves. So so they don't get a lot of large animal experience in tech school, and so even the people that I look at, I have to be very cautious about who's applying because of how much horse experience they actually have.
Yeah.
So you just don't want somebody that, oh yeah, I'd like to work with horses and never touch the beast, and because there is a little bit to handling them. You need to know how to handle a dog, cat, and anything else, but even more so with a 1,100 pound horse, you need to know how to handle that and be around that. And so I have to be very discriminate about how I look at those technicians too. So again, some of it training, some of it experience, and if you can get both of that, that's wonderful. But the hands-on experience with the animal that I'm looking at needs to be one of the highest things that I prioritize. Right. So that's kind of what I have to watch out for looking at for a technician.
Right. Well, and then I mean, I think attentiveness, and so two things. I mean, and being able to read the animal, which I mean, so with the attentiveness, I mean, with what you do with the acupuncture, I mean, I think of Mindy in class talking about the tendency to want to do Facebook or whatever while they're doing the horse. I mean, there's super huge safety things,
and that's why a lot of times I'll ask the client, "Would you mind if my tech here holds the horse for me?" Because I know she doesn't have her phone out.
Yeah.
I know, because if she has her phone out, that's a breach of my practice protocol.
That's wonderful.
Because she can have the phone out when we're driving.
Yeah.
We have plenty of downtime that we call windshield time, that she could have her phone out or whatever needs to be done. But in my practice, I need the most attention, and we don't have time to be looking at our phones. If I have a call come in, I'll look at my phone, but that's me, but I have attentiveness when I have my tech with me.
Right. Well, and you're captain of the ship, and so
Absolutely.
If something happens, that falls on you.
Absolutely.
And so one other area that like with the whole COVID and the whole Zoom thing and the whole remote learning thing, we've wanted to teach massage, and I mean that is a very hands-on thing. It's very it's it's ideal to have everybody in the same place. But, just teaching techs anything hands-on, we haven't been able to do it because there's no professional liability insurance that we can have for kind of ourselves, because they're used to working under a vet's.
Absolutely.
And so that's been a problem, but just, I don't know. So with the remote, there's more that we can talk to them about if we're not physically there responsible for the animals that they're engaging with, especially if they're from another state or something. So
right.
I don't know, but
right.
If they can learn, even a few simple massage techniques to help calm the animal and all that.
Right. It's kind of hard, with the horse, because, if they're not used to, if they're used to being handled, that's great, and they can pet their head and everything else.
Right.
We got, another 6 feet of body that I'm going to be working on,
Right.
So,
right.
That's
right. And then a lot of times vets will delegate the laser stuff to them. And I know you use the class 1M, and, so that's not so worried. But I just had one of our graduates submit a case report recently, and she was using a class 4 device on bladder 25. And I don't know and I had posted this on our Facebook group, but I don't know what happened, but it burned the horse.
Ooh.
Yeah. And it's one of them that has the beeping. So, and I've had dogs that have come to me for treatment that have had laser elsewhere that they develop this phobia once they hear that beeping because they've been burned with the class 4. So I don't know, just sort of a segue. So techs, like whether it's a tech or a vet doing a treatment with class 4, that's where you have to be so vigilant, understand that, it can burn them. And I have my hands on, and I'm always feeling like where the tissue is.
That's you. That's you. That's what you've learned to do.
I've learned to do that. But even when I've treated humans, like there's different parts of the body, like, getting up like the back, you can have a certain amount of power. And then if you go to the neck, it's like, whoa, that's too hot.
Yeah.
So so much to think about there too.
Yeah. And that's what I've done too, is like, I've let my tech had my tech do some laser stuff, and that's, it makes them feel like, oh, I'm doing something, that kind of thing, where they're contributing to the health of that animal and not just standing there holding the horse or whatever. But, and sometimes when I'll have a client that's really good with holding their own horses, that's great, because my tech can be out doing other things to help me too, which is awesome there. And I've had my techs remove needles and keep track of them and make sure that everything's going well and everything. And that gives me more time to go to and maybe do another horse,
right?
And look at it and do something there. And then we can do more at the same time with the same kind of thing. But I really believe that technicians are a huge asset to us in veterinary medicine, and I think a lot of us in equine medicine are missing the boat on not having one.
Yeah,
if you don't have one already, And it took me several years to finally figure out that they're not a burden that you have to pay, but there's an asset that you get to pay.
Yeah. So, well, and I. Like with Danielle, she has like 11 or something in her rehab clinic up in Ontario. She has like 12 employees or something, but and these technicians are helping her with all the rehab, and I think that she talks about, because she's educating them about watching the animals and stuff, and you have this another opinion, a set of eyes, understanding, and maybe you just didn't see something, but the better they become at learning how you are.
Absolutely. Yeah.
That's nice.
Did you, I've had a good tech in the past say, did you notice that area on that horse's back? I'm like, oh, thanks for telling me that. Reminding me of looking there. So, she had, it was one of those things where she knew from actually going to one of the student AAEP courses where we did acupuncture and rehab.
Yeah.
And that was a couple years ago. And I went ahead and took her with me so that she could become part, because I think that was the important thing for her to see
Yeah.
also. And that really had helped me out.
Yeah.
So that was really good too.
Yeah. Are you doing much rehab or, kind of
Well,
exercise prescriptions?
kind of, yeah, I prescribe it. And it's one of those things, but they love to be able to do that. I mean,
Yeah.
that they love to be able to go out and follow up on certain things,
Mm,
and to say, yes, doc, this helped, and we were doing this, and we were doing this, and so they're rehabbing their own horses gives them that feeling of participating in the health and well-being of their animal too. So
right.
I
Right.
think that connects me even more to that client.
That's right. And with telemedicine kind of too evolving, and just everything that we do, like the more video we get of animals moving, we see how informative that is, and then especially slow motion. And
Right,
now, me, and I want to do the how to see a horse thing,
right,
because
right.
we have to do that. But videos are so important, and that would be another thing a tech could do maybe, is for follow up, or even the client can send you a video, and you're,
Absolutely.
you know,
Absolutely. That client I was telling you about is a trainer and also a vet tech.
hmm
She has I have an upcoming appointment with her, and she said, here's a horse that we have a lameness issue with. And she sent me like a 5-minute YouTube video of the horse, of her riding it, and giving me some the look into that, so that when I get there, I have an idea. I already know which limb it is.
yeah,
And but I said, I agree with what you're seeing, but there's nothing like having my hands on it, doing flexion tests, checking the back, the pelvis, the SI, the LS, all of that, because any of all of that can be involved.
hmm
And so just having that idea, and then maybe later on, when we've whatever we've done and diagnosed and treated, having her resend a video to see how that's doing,
right.
and being able to compare that. And I think with the technology we have now, it's easier to have more and more of these small amounts of video
hmm
to do things, and even I invested in a GoPro just to see maybe
Oh,
if I could get some idea, see, and because as I age, I don't think my memory is quite as clear as what it was. And so, so on some of these horses, especially some horses that have some subtle neurologic symptoms,
hmm
just to be able to have them videoed so I can see what I'm looking at again,
right.
and to clarify my thoughts in the medical record, and see that kind of thing. And so just be another thing. I mean, I've already used it on a horse that had some abnormalities in the mouth.
Wow.
And so to document those, to have those kind of things, that I could do a biopsy on those lesions and send them off with the pictures of those freeze frames to the pathologist, that has really helped too. So I see what you're saying, and I see where that's coming from. And so, and not just our description, but I mean, our technology is so easy to use now, and we're all in the digital world where we can send these within a moment's notice,
Right.
and have these pictures and these videos to see that kind of thing. And I think with COVID, we've actually found out that we can do a lot more with, video chat and Zooming and whatever we want to do, and to be able to connect with people and see, I could imagine saying to the client, "Go ahead and turn your phone around and let me look at the horse move."
Right.
Right?
Absolutely.
And but yet know that, okay, yes, that looks like I need to come out and see it. Now,
hmm
even before COVID, clients would send me a picture of a wound and say, "Does this need to be sutured?" And I go, "Yep, it does. I'll see you in about 20 minutes," that kind of thing.
hmm
So they had already been starting to do that now, but now we can even do it with video, so we can see what's going on. How can we track this? And how is that horse moving? Horses move quite differently when they're either under saddle, being ridden, versus just on the ground doing, lunging. And so That was the concept behind this video that the client sent me, was this horse didn't move didn't look lame on the ground, lunging. But when she was being ridden, she would be doing this hop every time she tried to transition to a different lead. So it's like, that's the kind of video I need. Something that's a little bit different, and she recognizes the difference, so, and that's a good thing.
Yeah. I mean, well, and that's a good point. I mean, you're putting, 100 plus or minus pounds on the horse, so everything is being compressed, and then you've got the different vectors and everything.
And yet you have them then controlled differently with their head, and you get them positioned in a way. Absolutely, you get the few hundred pounds of people on there and tack, and they don't know. It's kind of hard to say. What are you putting? You're putting more pressure on the TL junction or LS. What is this that we're looking at? What does that make that horse do biomechanically to offset itself? And then that's where my whole exam comes in, where my fascial movement of the horses, and then my myofascial exam, how that depth we get into the body, that we can see things.
Yeah.
It's just so amazing what I have found with just an exam and either a response to treatment or a lack of response to treatment.
Right. Well, and the lack of response to treatment, I mean, my usual thought is that to look back at the diagnosis and to do more myofascial, which I agree is more challenging on the horse because they're not so squishy and everything. But probably that's where, some of the challenges like the gator or whatever, that Tim talks about.
Well, and that's the thing is, I think that with them is getting that myofascial, yes. But then I think of a case that I had years ago where I had done my exam and I had treated this horse for months and we weren't getting anywhere. And I knew that there was something else underlying it. So I sent it off to CSU for a referral for an ultrasound of the SI and LS and get that. And it came back wild with, they had an abnormality at the lumbosacral junction of unknown consequence. And they didn't know exactly what it was. They injected the SI, and even a month later, it still wasn't any better. Come to find out, at necropsy, the horse had a segment of the LS that was way off and broken there.
Oh, wow.
And they, it wasn't able to see exactly what was going on with all of that stuff, but my hands saw it.
Yeah.
Kind of thing. And, and the response to treatment was that it wasn't getting better.
Right.
Right. So that's what this course has taught me, is to get into there and to say, there is something else that's going on, that it's just not fixable this way. So let's look at it another way. And it was just not a fixable situation, period.
Right. And I remember it was more and more years ago now. I think we were at one of the acupuncture sessions, and I think it was Kevin Hostler that was teaching just about all the crazy pathologies that can happen, like all these fractures in horses. I mean, there's so much there, and sometimes that's frustrating because of the typical limitations of diagnostics that are done in the large animals. And I'll be reading case reports and grading them to the best of my ability for a large animal. And it's always like, yeah, there was some kind of lameness or back pain, but there's not really, it seems like that even having the differential of some fracture or something going on in the back, when they're not seeing as much of a response as they thought they would, I just feel like there's this wealth of equine pathology that never even gets considered or found. So just to have, like, hear from you, like, there's something there, you tried things, it wasn't working. So then there's that next step. I think that's a piece that the students maybe need to be reinforced on more. It's like, it's not that you did a bad treatment necessarily.
Right. Right. Yeah. I mean, because we threw everything we had at it as far as needles, laser, gabapentin, methocarbamol, and everything. We had in the SIs injected. Um, it just, it was one of those things where that horse wasn't going to get any better, and the pathology is there. And it makes me think of other horses that may have some other pathologies that I may have missed along the lines, but I didn't know it. And
Yeah.
uh, again, that gives me more satisfaction to know that I have that ability now to look past that and to say, maybe there is something else here that long ago I may have gone, well, who knows?
Yeah.
That
Well,
kind of
I think that that's where us increasing our observation skills, like the how to see a dog or a cat, but it's going to be different. Like you mentioned, uh, that that horse that was lifting the head. I mean, isn't that an antalgic gait that I'm just now learning about because I'm reading about posture more with
yes, yes,
horses
yes,
versus a lot of the dogs and stuff they just ventroflex when they're going like that. So that's a species difference, but
right,
it
right.
yeah,
Yeah,
it's
so
so
yeah,
important.
their dorsal flexion and their hollowing out of their back is something we always, and equine practitioners, we've always been looking at this as far as lameness goes. We look at length of stride, we look at their posture under just standing there, looking at where their feet placement. Um, we'll look at, one of the things that we look at is for a Sweeney is the drop shoulder, or dropped elbow. And so we look at these different things naturally as a practitioner and doesn't even come to mind. Now, how do you put that into words? Well, you know, you ask, well, how do you look at a horse? Well, I just look at it. It just seems to be, that's the way I look at it. I can see that horse looks like it's got its head up and its tail switched and it's painful. It's got some pain somewhere. So I need to figure that out, and so, yeah, maybe they'll have a little bit less muscle coverage over one side
Mhm.
of the hip and that. And it's again, like what my one client had said in her description and her video is like, she isn't well muscled in the haunches. Well, there's a lack of use in that area. Then, a good client, I mean, a good person like this with some background in medical history or medical will look at these things and say, that's not normal,
Yeah,
So that gives me another clue. And so then I may be more specific on looking exactly which muscle group is lacking in that area,
right,
you
right.
know? And
And then
so it's
yeah,
just another challenge into my practice, which makes me feel much better about what I'm doing. Again,
right.
it gives me more. It gives me more fulfillment in my practice life. You know,
That's the key.
yeah,
Um, but yeah, I mean, and that's where too have instructing the client, like if they are having lack of engagement of the gluteals or have become atrophied or something, and you're going to do some tickles or something so that
yeah,
they
yeah.
engage, um, and then the client has something to do, and then there's the whole human animal bond thing where I mean it's such a other end of the continuum to do like what we're doing and how we're approaching medicine versus the whole domineering kind of thinking the animal is just being a jerk or something. I mean, it's like such a gamut of
No, yeah, and that's the
things.
thing that I think I've tried to teach a lot of my clients is that no, I don't think this horse is just being a jerk. I think we've got some pain issues here.
Yeah,
And let's work on that. Let's see if we can get rid of that.
right.
And then what's really remarkable is seeing these horses that are so painful become more docile.
Mhm.
And then they really start to look forward to seeing me
Yeah.
come. I have a client that I do a horse every 2 weeks with my acupuncture. But she's so sensitive, I can't really get needles into her. So I laser her all the time.
Hmm.
And when I first start doing my exam, she's not very happy with me because I'm palpating sore areas.
Yeah.
And she knows it and she tells me. And she's very sensitive horse, and so I understand that. But once I get that laser out, she's all lovey-dovey and trying to nuzzle me and just go, oh yeah. And then when I get my little um, hand
Massage
massager out,
thing. Yeah.
oh my goodness, does she love that?
Yeah.
And you can see the horse's expression. Their head drops, their eyes kind of glaze over, their lips twitch. You can see their expression change completely. And that's just with the laser,
Yeah.
So anytime that anybody tells me that my laser doesn't do anything, I tell them, well, I can't say that because this horse does pretty well with it.
Right. And you could send them a video conceivably.
Exactly. And so that's the thing, that's why I love that laser because
Yeah.
it's so safe, but it simply works.
Yeah. And so just thinking of that joy, that rewarding piece, that satisfaction of working with animals the way that you adopted and integrated. I mean, isn't that the reason you went into vet med anyways, or was there some other draw in the beginning?
No, I grew up on a farm ranch and I remember being intrigued and seeing probably when I was probably 5 or so when my grandfather had a calf that needed to be pulled. And I don't remember this specifically, but my mom tells me that, yeah, I was right in the middle of that, trying to get him to see where it was.
Wow.
And then there was later on, I was very fascinated with this dead rabbit that got caught in machinery, and I was dissecting its eye with a stick,
Yeah.
and a plastic knife, trying to figure out what's, looking at that. So I always had that interest in animals and that. And then I found out that besides being a farmer or rancher, there's other ways to help them, and that really intrigued me all the way through. So that just came about where I never thought I'd be good enough to be in vet school. And I was surprised that I got accepted after my first try. I'm like, what? You got the wrong guy. No, you don't mean me. Because it was one of those things where I went back to school. I was looking at I went back to school. I got into vet school when I was 29, and I got out when I was 33. So I was one of those, what do they call, non-traditional students? So
we used to call ourselves the senior citizens in my class.
Yeah.
How old was I? I don't even know. But anyway, 97. Yeah, I was 30. I forget how much I was. Something. But yeah, right. What did you do first?
Well, when I got out of high school, I went to one semester of college where it was the best drinking party I ever had for 3 months. And I decided that wasn't what a good way to spend my tuition on and how I was going to pay that back. And then I went into the Army for 4 years. And then when I got out of the Army, I went to work for a quarter horse ranch and seeing, things like that. And then I saw the farm vet come on the place, and I was helping him and doing some things like that. But I was like, man, that would be the thing to do.
Yeah.
And so at that time I was divorced and from my first wife, and I got my second wife, and she's like, I was going part-time to school a little bit because I knew I didn't want to shovel manure my whole life.
Right.
And so she said, well, if you're serious about going to school, and I'll help support us as we go through that. And 8 years later, I was a veterinarian. She's like, I didn't anticipate 8 years of college.
I see. Yeah.
But that's kind of intriguing because I didn't want to shovel manure all the time, but I'm arm deep in it a lot.
I see. Yeah.
So that's kind of where I went from there. That kind of thing. So it's one of those I was led this way, and I'm happy I'm here. I
Yeah.
don't think I would see myself doing anything else
Right. Right.
ever.
Yeah. Well, I'm happy you're here too. And
Well, thank
I know
you.
that you inspire a lot of our students. And
Well, that's good to hear. I need to hear that sometimes.
oh, yes, you're wonderful. You give us that broad perspective of, of being out there treating clients, in a no, I'm not saying you do general practice, but it's
Well,
very
I do.
one-on-one.
I do
Yeah,
general
you do.
practice.
Yeah,
That's what I do.
you do general practice plus all the integrative and the dentistry and everything. So it's real world experience, and you're so patient and kind, and so we really do value you a lot.
Thank you. I appreciate it.
Yeah.
And I keep learning from all the students that come in too. Just and helping them, just trying to teach them is teaching me a different way to teach them each time.
Right.
So that they can understand what I envision and what I'm seeing and what I'm doing, so that I can help them along the way, and I was really appreciative. There was just this past session that we had, I had one of the graduates contact me and say, "Hey, what would you do here?" And they had a case that they wanted to kind of follow up on, and it was very nice to know that they could, I had no problem with them contacting me at all.
Yeah.
It was nice for them to think that they could value my experience, and look to me to give them something to do, and give them an answer kind of thing. So sometimes I don't know if I have the answer, but I try.
Yeah. Well, I mean, and that's where we could talk about this another time, but we'd love to have you with the EMAP course and just to talk about cases. But
Sure.
Oh, good. So
well, I said it on film, didn't I?
Yes, you did.
Are you recording this?
You can edit it if you change your mind before this weekend. But I think you'd be in. I can probably send you a snippet of the video because Steve has been teaching for us, and the case that he's recorded so far is traumatic myopathy in a pony, and he talks about the anyways, it was this fancy horse and all this stuff, but he had some kind of injury back here, and so I think Steve contacted you, and you gave him an idea about how to address the myopathic injury there.
That was so long ago.
Well, it's now recorded in posterity, and he was talking about he was flummoxed. He didn't know what to do, and I think maybe because he was relatively new, probably.
Yeah, he had just graduated from the course.
Right. But he, and I think I would hope that most people, I would hope that somebody could just come up with something, but I think that you have something that's new and it's a little bit startling maybe to the brain or nervous system. It's like, I don't really know what to do. And it's just nice to have somebody to call.
Oh, absolutely. Yeah.
And just like, that's something Danielle was saying too, like when people buy into a new practice or are just out a new practice, and you just want somebody out there. And that's what I love about our community too. Yeah. So anyway, so there's I'll send you that piece of the video, and he talks about just how you came up with an approach, and it worked very well. So you're already famous.
Wow.
Yeah.
I didn't realize I had that impact.
Oh yeah. Well, that's the thing. I think you do have a lot of impact, and I think part of what I should be better at is building this community and talking to you guys, which is what has been a nice thing about the EMAV program. So because it and even through this Zoom, even though you're not that far away geographically right now, but the fact that we can meet and just hang out for an hour,
right?
And
when you have asked us, in a general email about EMAV, I'm like, well, I don't think I have much to contribute because I'm not sure I have anything to tell you. I'm no expert. I'm not board certified. I'm not, anything. I'm just a general practitioner who happens to do acupuncture with that. It's
you have,
what I kind of get in my mind.
well,
Mhm.
yeah, you have lots of experience and you have lots of wisdom, and you're very observant, and you care, and your hands are very educated, and you have all these different ideas, and I just the whole board certified thing, like, you have education, like direct experience, and that's you can't teach that.
Yeah,
You have
I
to
guess
grow
so.
that.
I
Yeah.
guess so.
So yes, we'd love to have you. I'll be in touch with you more
Okay,
about that.
that'd be great.
Yeah.
If I can share my experiences and it helps somebody, that's wonderful. And just to hear that I helped Steve, that was
Yeah. Anyways, I'm very excited about that's a great outcome of this conversation too. Is we're gonna
yeah. I had a veterinarian from Nebraska contact me about the way I do dentals,
hmm
and I I don't know if this is going to go on the podcast or not, but I do dentals by hand, whereas everybody around me nowadays is doing it with a machine where
mm,
they're grinding them down like with a Dremel tool, and that seems to be state of the art and everything else. But I don't find that helps with the overall biomechanics of the mouth,
mm,
and it doesn't take that much to do it correctly the way I do it. And so anyway, he came from Nebraska and wanted me to tutor him on some dentals, and so I took some of my horses out that hadn't had dentals, and I went through them, and it was kind of, I see where the one-on-one is very, very good in teaching someone,
hmm
because we spent several hours there just working on this and that. And so and actually he's works for the USDA, but he also practices part-time as a chiropractor and acupuncturist.
hmm
And so he would kind of want to integrate dentistry in that. And he took the course several
Yeah.
years. Anyway, he it was just one of those things where I realized that trying to teach someone something very specific like that took a one-on-one kind
hmm
of thing,
hmm
and to show them how exactly to do it needed that one-on-one. So I too, like you, would get into these on-site sessions and be like, okay, all right,
Yeah. Right.
let's try to teach all these kids.
Right.
Then
Right. Right. Well, I mean, and even when we used to be in the big hotel ballrooms,
Mhm.
and whether I'm a teacher just watching somebody else's lecture or a student, it is just so just all this stuff is distracting, and so that's why too for the online piece. Back several years when we ran that first of the 4 modules, and we had some people sign up for the online piece versus people that would sit there for the 4 or 5 days,
Mhm.
and compared their exam scores, that the people that had been online, that was the eye-opening thing for me, is that they did so much better on the tests.
Oh, they did.
they
Wow.
they way outperformed them, and that's why it was what, 2013 or 2014, that's why I decided to put all the didactic stuff online, because they can do it at their own pace, they can
Right.
review it.
No,
So
that's
there's
a
a
good
lot of
idea.
benefits, yeah. And then we're offering them the opportunity to come on site for 2 days. So it's like during COVID or whatever you want, you can do it remotely. And then if you want to come see us at the school or at the
Yeah,
barns or whatever, you
yeah.
have that option too. So anyway, but just back to the one-on-one. I mean, that's how medicine used to be taught, like with apprentices and stuff. And
It is so true. It is so true.
yeah,
Um, because I learned a lot when I was being employed by other
yeah,
veterinarians, and you get that one-on-one with their experience, and hopefully they've got some good experience, and maybe you learn from their bad experiences, and
yeah,
that's kind of way it goes. You got to have some bad experiences to find out what the good is
right.
and all that.
And to learn to trust yourself, I think, or to an extent, your intuition, like, or just understand that that didn't feel good. So
Yeah,
what were the signs that told me and everything.
yeah.
Great. So we have a lot
lot to catch up on with all the
Yeah.
course stuff, and this was really helpful.
Well, it was great talking to you again.
You too. Good to see you.
I don't get to talk to you one-on-one much, but it was
I
fun.
know, hardly ever. So, okay. Well, look, I'll get you an email and everything,
Sure.
so we can follow up. But thank you for doing this, and I think this will be a nice way for you to get more engaged and be another ongoing like kind of resource for people.
Absolutely. I'm more than happy to help out.
That's
More
wonderful.
than happy. Yeah.
Thank you.
All right.
Okay.
Take care.
Take care. If you'd like to learn integrative medicine from a scientific perspective, visit us at curacore.org. Thanks for listening to another installment of Surviving Veterinary Medicine.